will talk about, first of all, how WHO defines social determinant of health and what framework of social determinant of health WHO gives, and then we will discuss how US government, CDC, presents social determinant of health in USA, and then a group of authors led by Evans, they gave also some classification of social determinant of health. So we will talk about this classification, and at last some examples from USA, how social factors determine our health. Determinant of health are factors which or conditions in the places where people live, learn, work and play, and that affect a wide range of health risks and outcomes. And, and WHO established a special commission on social determinant of health, which defines that poor health of the poor, social differences in countries, obvious inequities between countries are conditioned by unequal distribution of power, income, goods and services as in global scale, as within one country, and as a result, injustice in people's life conditions, their access to healthcare services, education, their working and leisure conditions, their home, society, city or village, and their chance to lead a flourishing life. Such as unequal distribution of conditions that adversely affect health is not a natural phenomenon. Together, structural determinants and daily living conditions are social determinants of health. And and you know that they are apparent in the living and working conditions that people experience every day. So we have to emphasize social determinants because they have direct impact on health, and they predict greatest proportion of health status variance, and they determine our health behavior, and also they interact with each other to produce our health. And social determinant of health influence health in many positive and negative ways. So extreme differences in income and wealth, for example, have negative health consequences for those who are living in poverty, and these effects are magnified when these people are congregated in poor regions. Yeah, and here WHO Commission presents his framework. Yeah, you see conceptual framework, where we have to consider all social determinants of health from the left side to right side, and from above to down. Yeah, you see, and you see that in the left side they gave basic or fundamental social determinant of health, which includes socio-economic and political context, represented by governance, policy, cultural and societal norms and values. And you know that, of course, for example, Indian or Japanese socioeconomic and political context, they are different in these two countries. And because, yeah, you know that GDP or macroeconomic situation in Japan is better than in India. And cultural and societal norms and values are completely different in Indian society and in Japanese society. So that's why they act or they determine health of population, all population in India and in Japan. And and all these fundamental determinants, they determine social position of each individuals there, because for example, you personally, they have certain education level. Yeah, you had some years of high school, you finished high school, a certain quality of education, yeah, and when you will graduate from medical school, you will get some degree, university degree, medical diploma, and you will get some job, you will have some income, and in some years you will earn your own social position. You see, you will earn social position, and your social position, of course, will be based on what is your education, what is your job, what is income, and somehow it is also determined, unfortunately, by gender and ethnicity and race. And we will talk about this also later, next lectures also, because there are still some gender disparities and still racial differences or ethnical differences in health, unfortunately. So that this social position will allow each individual to have some certain material circumstances. Yeah, for example, if you will get good job, good income, you will buy own house. Yeah, you will provide your family good living conditions, good social life. Yeah, your children will go to good schools. They will attend some maybe piano class or gymnastics or something more activity. Yeah, and you will buy a house in good neighborhood. Yeah, you see, and you will have certain social cohesion with your neighbors, with your colleagues at work, with your friends, yeah, with your family. So, and because of this social cohesion, you are living not alone with other people, you will interact with other people, and you will have certain living conditions, working conditions, family conditions, social conditions. So you will have certain psychosocial stress. Yeah. And because of your education, because of your family traditions, because of your closest people, friends, you will have your own style or lifestyle and your health behavior, certain features of your health behavior. And of course, each of you have own genetics, own biological constitution. So that is all together based on social position will form your status of health, your well-being, your quality of life. And we have to also note that big importance of healthcare services, how availability of healthcare services, quality of healthcare services, and that these all are determinants of health. The same pattern, the same framework, WHO defined, but with division of structural determinants of health inequities, you see, and intermediary determinants of health, you see. So your health and well-being, health and well-being, yeah, impacted by structural determinants, structural factors, and health inequities, but through intermediary determinant of health. Here you see material circumstances, behaviors and biological factors, psychosocial factors, you see, social cohesion and social capital, and also health system, public health system and healthcare system. And here we have to also look how social determinants, or how our health is structured or impacted, or on individual level and also on society level. Yeah, you see, on individual level, we have to look first of all on social position. What is social position of this individual? And on society level, we have to look what social context we have in neighborhood, in society, and what social policies we have in this society. So, and we look also how we classify, or how big the range or list of social determinant of health. For example, US government, or also Centers for Disease Control, they define 4 or 5 groups of social determinant of health. You see these 5 groups of social determinant of health, which you see includes 5 key areas. Yeah, economic stability, education, social community context, health and healthcare, neighborhood and built environment. And let's start with healthcare access and quality, and the connection between people's access to and understanding of health services and their own health is important. And this domain includes key issues such as access to healthcare, access to primary care, health insurance coverage, and health literacy. Education access, yeah, you see education, the connection of education and health and well-being is high importance also. And these domains includes key issues such as graduating from high school, enrollment in higher education, educational attainment in general language and literacy, and early childhood education and development. So social and community context, here of course we have to look the connection between characteristics of the context within which people live, learn, work and play, and their health and well-being. This includes topics like cohesion within a community, civic participation, discrimination, conditions in the workplace, and incarceration. So, and economic stability domain, here we look the connection between financial resources people have income, cost of living, and socioeconomic status, and their health. And this area includes key issues such as poverty, employment, food security, and housing stability. And the last domain, neighborhood and built environment, considers connection between where a person lives, housing, neighborhood, and environment, and their health and well-being. It includes topics such as quality of housing, access to transportation, availability of healthy foods, air and water quality, and neighborhood crime and violence. So, and all these five key areas of social determinant of health, they form so-called social structure of our health. And why is social structure? Because the social context of our lives are not just random assortments of events or actions. They are structured and patterned in distinct ways. There are regularities in the ways we behave and in the relationships we have. Human society is constantly being restructured by people themselves, and our everyday life also is different. Today we had different life. I mean, yesterday, today we have a different life. So, and why we have to consider social structure? Because the social structure of a society impacts health of this society. And we know that top people live longer and they are healthier while doing so. And social structure, there is a strong relationship between social status and health. And we measure social status of individuals by income, education, and occupation, and social status of a group of people is measured by area of residence and level of difference. So here you see example of how our health, how our health is determined by social conditions. And here you see different world regions. You see African countries, Morocco and Mali, South Asia, India, South America, Peru, and Central Asia, in Eurasia, you see, and different social classes. Poorest group of people, and richest group, you see, by wealth group. And what is under 5 mortality per 1,000 live births, you see, in all regions of the world, we have the same picture, that the highest under 5 mortality rate we observe among the poorest part of population, and the lowest life expectancy, under 5 mortality, we see in richest part of our population. So another example, increasing income inequality among countries, where you see the GNI per capita, we had in richest countries and poorest countries, and what is difference more than 40 years ago. Yes, you see that ratio we had 60, and 20 years ago in 2000, this ratio almost doubled, 115 Yes, the difference between richest countries and poorest countries in GNI. And 5 years later, yeah, it becomes higher, this ratio, and maybe today is not double, but maybe is triple. So you see, that is another example. Main issue today we will talk is how researchers consider social determinants of health, what group of social determinants of health they divide, and you see that we have this classification from Evans and his group. Yeah, this classification was published in the Built Environment and Mental Health paper in Journal of Urban Health in 2003. And you see that they divide all social determinants of health into 4 groups. And yeah, you see fundamental, intermediate, proximate, and health and well-being group. At first glance, of course, this classification is very complicated and very big, but it's not so complicated. It's not so complex, as you see. Let's start with just grouping, fundamental, intermediate, proximate, and health and well-being. And we start with fundamental determinants of health. Fundamental social determinants of health are those which act on national, country level. They are similar for all citizens in a country, for all population in a country. For example, in India or in Pakistan, you have the same fundamental social determinants of health for all citizens in India or in Pakistan. So, for example, natural environment. You know that a natural environment which was given by our God to Pakistani people or to India in your region. Yeah, you have your own climate, certain level of temperature, relative humidity, and sunlight level. Yeah, you have certain properties of your soil, water sources. You have your own, surroundings. What you have, forest, jungles, or animals. Yeah, what food is available in India? What food is available in Japan or in Kyrgyzstan? It is same for all people in those countries. Natural environment. Yeah, it is fundamental. Yeah, you see, they are the same for all citizens. The same is for macrosocial factors. Macrosocial factors, you know that all Indian population have the same history. Yeah, you have a long, Indian society has a long history, and it's ancient nation, more than 6,000-7,000 years of history. And historically, in some moment of history, your Indian society developed Ayurveda, and you started herbal medicine, and still you use herbal medicine. It plays still important role in improving health of Indian society, Indian population. So that is macrosocial factor, one of them, your history. Or history of Kyrgyz population. Yeah, we used to be nomadic. 100 years ago, Kyrgyz population had nomadic life. And somehow it still has some effect on health of population in Kyrgyzstan. In some aspects. For example, attitude to our environment, how we keep clean or dirty our environment, built environment even. Political orders, what political and economic and legal order we have in our country, in our state. It, of course, you can bring thousands of examples how political situation, how political order or if economic situation condition your health status of all population. Or human rights doctrines. Yeah, are human rights protected in your country, and how the level of protection, and how society built some social institutions or cultural institutions to improve social and cultural life of population. And what ideologies, for example, ideology in Japan and USA are completely different, and they impact health of population. For example, why in Japan they have high rate of suicide? Why people in Japan, they have high level of psychological stress, mental stress, as at work, as in families, because of ideologies, because of cultural values, different cultural values, family values in US family, for example, or Japan family. It's completely different. Or you can compare, for example, Indian Indian families' view on nature, and in America. These are different, and that has certain influence on health of these family members. The third subgroup of fundamental social determinants includes inequalities. Inequalities in distribution of material wealth, first of all. Yeah, you know that unfortunately every society in our world divided in social classes, rich, upper class, lower class, middle class, depending on income level. And you know that there are these in employment and educational opportunities are different, distributed among those people, among richest, poorest, and middle class. And also, you know that high class people, upper class they have more political influence than lower class people. So that is fundamental determinant of health. Again, they play at country level or national level. The second group of determinants of health are intermediate social determinants of health. They act or play on community level. For example, Bishkek community, or Osh community, or Issyk-Kul community, or New Delhi community. Yeah, you see. And in these, for example, in New Delhi or Osh and Bishkek cities, communities are a little bit different because they have certain differences in built environment. Yeah, we can compare public transportation in Bishkek and in Osh. We can compare what public resources we have in Bishkek and in Osh, and what buildings we have in Osh and in Bishkek, and how we use in Bishkek, how we use land in Bishkek and in Osh also. Maybe we grow our food with using fertilizers and pesticides, or we grow organic food. that can be different, yeah, you see. And of course, also social context of our life in Bishkek and in Osh has some differences. For example, community investment can be different. If Bishkek municipality, for example, this year decided to increase the budget of all secondary, high school and elementary school teachers' salary, at the same time, this year, Osh municipality decided to increase the budget for road reconstruction, you see. So community capacity is different in Osh and in Bishkek because of many reasons, because of population number, size, because of the level of education and professional, the share of different professions, different industries in two cities. Civic participation and political influence is also different, yeah, in Osh and in Bishkek. And probably quality of education may be probably the same, but of course in Bishkek we have more universities, in Bishkek we have more educated people, we have more, or the quality of education may be higher in Bishkek universities and schools than in Osh, or maybe in other regions in Kyrgyzstan. So you see the social context determinants are differentiate or different in different communities. So these, of course, we call intermediate determinant of health. So they are different for different communities. The third group of determinants of health are proximate. And we look just Bishkek community. And in Bishkek, we have smaller communities within Bishkek. And proximate social determinant of health, they act on smaller group of people. For example, in Bishkek, we have certain community of Indian and Pakistani students studying in ISM or KSMA, yeah, Kyrgyz State Medical Academy. And you form your own community, smaller group, smaller community. And you have your own stressors and buffers, because most of students, of ISM students, they stay around Osh Bazaar, around Batken campus, yeah? And just few of you live in apartments maybe around Bishkek. So that's why you have the same environment. Yeah, you have the same neighborhood conditions. Yeah, you have the same workplace conditions. You attend classes and lectures in ISM buildings, and it's the same for all ISM students. You have the same housing conditions because you stay in the same dormitory. And you stay, unfortunately, it's not so good area of Bishkek in terms of criminality. And the area you stay less safe than area, for example, other areas in Bishkek. And you have own policy. Our Ministry of Education, our Ministry of International Affairs built certain policy towards treating foreigners, including you. Yeah, policy response. Yeah, police response also. Policemen. Yeah, also including that. Internal Affairs Ministry. And you have your own financial status. The same, similar, relatively similar financial conditions. You all are dependent from your family. Your family sent you money to live, to stay in Bishkek, to study in Bishkek. And you stay, you drink the same water, drinking water, you breathe the same air in Bishkek, so you have the same environmental toxins then. Even food the same. And you have the same, same level of treatment. For example, how you are treated in supermarkets or in Osh Bazaar or by our medical doctors or our policemen, how our police treat you, and or even our ISM teachers, how they treat you, how they communicate to you. It's the same, relatively the same to all ISM students. So that is about stressors and buffers. And as ISM students, you have similar, more or less, health behavior, because you eat in the same canteen, you play cricket sometime, you have the similar level of physical activity and similar level of health screening. Annually or maybe twice a year you have medical checkup. And you as ISM students, you built or established your own social network, and you provide yourself social support. You provide each other social support. Because you have even your own association, students association, and who helps some students. And you have support from our administration, from your edutech curator and mentor, and so on. So, and last group of social determinant of health is group of health and well-being. Health and well-being. They act on individual level. Each of you has own degree or level of hope or despair. Each of you have a certain level, different level of life satisfaction. Are you satisfied with your life or not? Do you have a certain stress, psychosocial stress, and it is different among you. And some of you are happy, some of you are not so happy, some of you completely unhappy. And you have different level of health. I mean, you see level of disability, some of you, and you have, each of you have completely different body size and body image. As a second subgroup of health and well-being, called health outcomes. And here, at first glance, of course, what is outcomes? Outcomes means result of some effect, some factors, result of influence of some factors. For example, infant and child health can be considered as result of or influenced by mother's health. How mother felt herself during pregnancy, what quality of food she ate during pregnancy, and what was delivery period, and how it was. And but today you are 20, 21 years old students, boy and girls, men and women, and your health today somehow can be considered as a result what health you had in your infancy and childhood. If you were healthy in your infancy and childhood, yeah, there is a big chance, the chance that now you are healthy is bigger than if you been so ill in your infancy and childhood. So obesity, for example, is a result of different factors, combination of different factors. Yeah, genetical, also diet, physical activity, lifestyle, working and living conditions, and so on. But obesity can be also seen as a factor for the development of other health conditions such as cardiovascular disease or diabetes second type or first type. You see? All these, cardiovascular disease, diabetes, cancer, injuries, virus, infectious disease, respiratory health, mental health, and all these health outcomes can be considered also as determinant of health also. So you see that there are, a big bunch of social determinant of health. And now I wanted to show you some examples of social determinant of health on so-called New Mexico study. So New Mexico study was conducted many years ago, more than 25 years ago, more than 25 years ago. So it is, you know that New Mexico is one of the poorest state in USA, and here you see characteristics. For example, poverty rate, 22% live in poverty in New Mexico compared to 13 in general in USA. And the ethnicity level, you see highest proportion of Hispanics or people, American who speak Portuguese and Spanish and came from Latin America, Puerto Rico, Costa Rica, Guatemala, or Mexican, and they have, you see more than 40% of share, and second highest Native Americans, more than 99%, you see. And if you see education level, so 7 out of 10 of Hispanics have high school or less. And Hispanics and Native American half as likely to have college than whites. You see 28% compared to 59% in whites. So I will not stop on this pathway, but you see that are overweight adults by race and ethnicity. This study found that you see that in Native Americans, they have highest 40% of Native Americans are overweight compared to, you see, only 25% in white non-Hispanic. Overweight by education, and you see that among people with university degree, you find lowest rate of overweight than compared to people who has high school or level of education. Overweight adults by income, and we see that the level of overweight is lowest among people with the highest income, and vice versa, that overweight is highest in people with the lowest income, So, and physically inactive adults by race or ethnicity. And here you see that Hispanics are more, the least physical active are people with the lowest income. Diabetes mortality rate by ethnicity or race, you see in dynamic, and you see that all time, the highest diabetes mortality rate we observe among Native Americans, and it's situation become more negative, and you see that among whites, non-Hispanic whites, diabetes mortality rate stays the same, and it is the lowest. This indicator, you see, shows that in different group of population, they have different social determinant of health, and they make this inequality. So we have these health disparities because of action of these social determinants of health. And we have these inequalities. I would say it is better to call it inequities, because it is a result of social determinant of health, not biological determinants. So that is inequities. Here you see that living in poverty, absolute conditions, and lowest place in social hierarchy of social structure, and having high demand in, for example, healthcare services, in social services, and at the same time having low control over their destiny, and living in not good physical, chemical, mental environment, having chronic stress at work, in family, and having low social support, having low social capital, you see, and of course lack of resources. All resources, some period where researchers, health professionals, they discussed, and they have, of course, still we have different opinions that what is most important social determinant of health, material conditions or psychosocial conditions are first. I mean, we have to consider the first, put on the first place, material or psychosocial conditions. What is more important, proximal factors such as social context, or distal factors, or for example, neighborhood effects versus individual effects. So, and we have to look what is effect of absolute position in a society or relative position in a society. So that I will stop. My lecture on